The cardiac exercise stress test, also known as a treadmill test or exercise tolerance test, is a common diagnostic tool used to evaluate how well the heart functions under physical stress. While this test is crucial for diagnosing conditions like coronary artery disease, it's important to understand that, like any medical procedure, it carries some risks and potential complications. The cardiac exercise stress test involves monitoring the heart's activity while the patient exercises, typically on a treadmill or stationary bike. The intensity of the exercise gradually increases, and the heart's response is monitored through continuous ECG readings. This test helps detect issues like coronary artery disease, arrhythmias, and other heart-related problems by showing how the heart responds to physical exertion. During the test, the patient is connected to an ECG machine that records the heart's electrical activity. Blood pressure and heart rate are also monitored. The test begins with light exercise, and the intensity is gradually increased. The goal is to push the heart to work harder and pump faster, which can reveal problems that might not be apparent when the body is at rest. While the cardiac exercise stress test is generally safe, certain complications can occur, especially in individuals with pre-existing heart conditions. Here are some potential risks. Arrhythmias. Exercise can sometimes trigger abnormal heart rhythms. In most cases, these arrhythmias are temporary and resolve quickly once the exercise stops, but they can occasionally be serious, requiring medical intervention. Chest pain or angina. Some patients may experience chest pain or angina during the test, particularly if they have underlying coronary artery disease. This pain is usually a sign that the heart is not getting enough oxygen due to narrowed arteries. Myocardial infarction. Heart attack, though rare, it is possible for a heart attack to occur during the test. This is more likely in patients with severe coronary artery disease. Shortness of breath or dizziness. As the exercise intensity increases, some patients might feel dizzy or short of breath. This can be a normal response to exertion, but could also indicate that the heart is struggling to keep up with the body's demands. Blood pressure changes. Blood pressure can rise significantly during the test, and in rare cases, this can lead to dangerous complications such as a hypertensive crisis or a sudden drop in blood pressure, leading to fainting. Patients with a history of severe coronary artery disease, uncontrolled hypertension, or other serious heart conditions are at higher risk for complications during the test. This is why it's crucial that a healthcare provider carefully evaluates a patient's health status before recommending an exercise stress test. In summary, the cardiac exercise stress test is a valuable tool for assessing heart health and diagnosing cardiovascular conditions. While it is generally safe, it's essential to be aware of the potential risks and complications. Patients should discuss these risks with their healthcare provider to ensure that the benefits of the test outweigh the potential dangers.